Good afternoon. I am Sandra Hahn with the Illinois Chapter American Academy of Pediatrics, and I thank you for joining us today's webinar on ICARE News and Review. Before we begin, I would like to go over a few housekeeping items. Phone lines are muted. This webinar is being recorded. If you have any questions related to the general functions of ICARE, please enter them into the control panel on the right-hand side of your screen. For any specific questions or issues, please note at the end of the presentation, there will be a slide with contact information to direct your provider office to the division who is able to address and support your provider office needs. Due to time limitations, this webinar is designed to address general questions on the functions of ICARE. Today we are joined by Ann Wong from the Illinois Chapter American Academy of Pediatrics. Ann Wong joined ICAP in 2014. Ann is ICAP's project manager for immunizations and related programs. Her primary interests in immunizations are to increase vaccination coverage levels, increase vaccine accessibility, and to act as the content expert for pediatricians to collaboratively work toward herd immunity. Prior to Ann's arrival, she served as a program specialist at the University of Chicago's Urban Education Institute. At U of C, Ann served on the Grants and Awards Research and Training team. Ann graduated from Northwestern University with a BS in Social Policy. Today, Ann continues to strive to advocate for social justice and public health for children and adolescents.
Okay, thank you so much, Sandra, for that introduction. I just wanted to remind everyone also before we begin that you will all be receiving a copy of the PowerPoint slides as well as a link to complete the survey evaluation by the end of business day, either today or tomorrow. So we're going to get started now, and once again I just wanted to thank all of you for joining us, and let's get started then. Alright, so these are my disclosures. I have no relevant financial relations with the manufacturers or any commercial products and or providers of commercial services discussed within this C&E activity. I do not intend to discuss an unapproved or investigative use of a commercial product or device in my presentation. This next slide just briefly goes over IDPH's vision and mission, which is that the communities of Illinois will achieve and maintain optimal health and safety, as well as protect the health and wellness of the people in Illinois through the prevention, health promotion, regulation, and the control of disease and injury. Today we're going to be going over how to gain access into ICARE, the difference between entry of data to ICARE with direct entry versus EMR, some common inventory issues, reminder or recall reports, coverage level reports including adolescent and childhood reports, vaccine information statements, the vaccine adverse event reporting system, some frequently asked question and answers, password support, and then we'll also have some ICARE contact info. So in order to gain access to ICARE, you need 3 documents. Gaining access to ICARE can take as long as 4 to 6 weeks from the time that ICARE receives all of the necessary documents. The 3 documents that are required to register an organization for ICARE Access are the provider site enrollment form, the web portal registration authority agreement. It's going to be referred to as PRA registration for the rest of this webinar, and then each intended user will also need to follow the IDPH web portal online registration process in order to create their username and password. I just want to reiterate how important it is that ICARE receives all 3 documents at the time that a user requests registration. If ICARE does not receive all 3 documents, then it can result in delays in access to ICARE. I know that when we were reviewing and putting together this PowerPoint, it was brought up to us that a lot of people fill out the provider site enrollment as well as the PRA agreement, but a lot of people aren't actually going online into the web portal online registration. So for any new and future users or any users who are still waiting for access into ICARE, that may or may not be the delay in the issue in getting your ICARE access. So we're just going to go over quickly some quick screenshots of how the forms look for everyone. Once again, we'll be giving slides to everybody at the end, so if I go through these a little bit too quickly, you'll be able to have access to them later on. So this is the provider site enrollment. Next, we just zoomed in a bit on where we need the signatures. And one quick thing that I do want to point out in this form, though, is that for medical facilities, it needs to be signed by the physician or medical director. And then for schools, it's a bit different. Private schools, it needs to be signed by the principal or president. And then for public schools, it needs to be the district superintendent. So if you are a public school, make sure that it is not your principal or president that's signing it and that you're actually getting the signature of the district superintendent. Next, we're just going to quickly review what the PRA agreement is. This is how the PRA agreement form looks. It has that idphnet.com logo at the top. What exactly is a PRA? The PRA is someone in your clinic or within your group who acts as the main contact with IDPH or ICARE for any questions or issues. The PRA verifies and signs off on all new applications for ICARE accounts. Please check that your clinic has a PRA. If you don't have a PRA at your clinic, please be sure to complete and submit the PRA application as soon as possible. This is just the web portal online registration website. We've highlighted in yellow the link that you need to click, and this is the form that I was talking about earlier where a lot of people fail to register. So you would go to this website and then click on that yellow highlighted link. It's not highlighted in real life, we just highlighted it here for you to see clearly. So next, this is just another quick screenshot of how you need to click I agree in order to be able to create your web portal account. Next, we have another screenshot of the web portal agreement. Everything that has a red asterisk is something that you need to complete. One really quick thing that I want to point out here is that it asks you to enter in your password immediately when you first fill it out, but just a reminder that it takes 4 to 6 weeks to get your account. In between that time, please do not forget what your password is. I would recommend writing it down somewhere on a post-it note, maybe in an email to yourself, but just anywhere where you will be able to easily gain access to in the future, since you will need that again. And then this is just another really quick screenshot of what you need to click when you're filling that out. You need to enter in your keymaster. And the keymaster is someone who can add or edit or delete employees. It's somebody who works within your clinic. If you don't select this option, ICARE will not be notified of your request for access, and then therefore that will just delay the process further. If you need to establish a EMR connection, you're also going to need to select the appropriate option for either an SFTP MoveIt account or a HTTPS web services account. We're going to go over the differences between the two types of EMR connections later on in this presentation. So this is where you select your portal registration authority. And then if you have any further questions relating to registration for ICARE Access, please direct all of your correspondences to dph.icare@illinois.gov. There have been a couple changes to the registration process so that all ICARE Access questions must now go through ICARE. PRA designations no longer occur with the DPH security office. You now have to enter in your PRA designations with ICARE directly. So just keep that in mind if you are newly registering or changing your PRA, to do that with ICARE and no longer with the DPH security office. Now we're going to review some data entry into ICARE. So once you have access to ICARE, there are two ways to enter data in ICARE. The VFC clinics should all be providing patient-level immunization data. We have direct entry versus electronic medical record, or EMR. When you're using an EMR, you still have to access ICARE frequently in order to ensure that your data was received. There are two types of EMR connections within ICARE. First, we have the SFTP Move It account, which is an account that typically starts with 777 **** or ELR. The SFTP Move It account is a one-way transfer, also known as unidirectional transfer of data from your EMR to ICARE. A HTTPS account, web services, is the second type of EMR connection. This is an account that will typically start with 888 ****. This is used for bidirectional or a real-time interface within ICARE. You will need to check with your EMR vendor regarding which method they're capable of transferring data under. If you have any further questions regarding EMR connections, please contact dph.hl7icare@illinois.gov. Next, we're going to be reviewing the Imports tab. Once you've established an EMR connection and you're sending data to ICARE, you will have the Imports tab available under your Clinic tab. So you'll find Clinic right here, it's circled in red, and then this will be the Imports tab. It's also helpful to know that in here, it'll show you the stats and it'll have the dates, and it should currently be today's date whenever you check it, and that's just a quick way to ensure that the EMR information is being transferred to ICARE. Within this page, you can also just find some statistics, general information on the amount of files that you have, as well as messages and shots over a time frame. There's also a link to the raw data, and it is sent by by message number as well as to the patient file. So this Imports tab is helpful for people who have an EMR so that you know what is being imported to ICARE. And also, if you don't have an EMR, you won't have the Imports tab, so don't be alarmed if you don't see an Imports tab within your system if you don't have an EMR. Next, we're going to be reviewing some common ICARE inventory issues. We've found that a lot of providers are still experiencing VFC inventory issues in ICARE, and a majority of these issues have been related to electronic transmissions through electronic medical records. And just a reminder for everybody to check their balances if they've ever lost access to ICARE, because a lot of clinics, when they initially lose access to ICARE, their balances are reset. So in order to ensure that you're moving forward with your balances corrected and not with a lot of errors, please be sure to check your balances once you regain access into ICARE. So these are the 4 components that every VFC vaccine transmits electronically. The first one is the vaccine brand name. I just want to clarify that ICARE does not recognize generic names for VFC vaccines. So please be sure that you're using the brand name. Next, it's the lot number. This is also something that causes a lot of inventory issues. One issue is that a lot of people see the number 0 and they're not sure if it's a capital O or a number 0. So just to say here now, it is always going to be the number 0. It is never a capital O. And in order for your VFC vaccines to be deducting correctly, the lot number must match the lot number that is in ICARE exactly. And just to give a brief case study or example of a common problem that a lot of people have is they'll be using the lot number that is on their vial, and then they'll find that their vaccines aren't deducting correctly, and therefore they'll have errors. The problem with that is that you should never use the lot number that is on the vial of your vaccine. You must always use the lot number that is on the box of the vaccine. So whenever you are writing down a lot number for your vaccine, make sure it is what is on your box and not on the individual vial. Next, we have the CVX and MVX codes. These are available and updated within ICARE. ICARE also now accepts NDC codes, which a few EMRs are now sending. This is a requirement for MU Stage 3, which does not start until 2019. In order to receive the most up-to-date version of the CVX and MVX codes, you're going to want to generate the Vaccine Management Report Vaccine Conversion Table. This report generates a mapping between NDC and ICARE codes. And just another heads up, all the flu codes have currently been updated within ICARE, so everyone should be able to find that. Lastly, we have the VFC status of the patient. And then on this slide, it's just a list of the VFC status V codes that everybody sees in order to determine VFC eligibility. We're now going to review how to generate some reports. The first report is the Clinic Immunization Activity Report, and this is a screenshot of it. You're going to want to ensure that you check the box that includes shots given not from inventory, as this will indicate shots that aren't being counted as VFC in the report. You should also just be sure that you're running coverage level reports on a quarterly basis. This is a screenshot of how the report looks once it is generated. And then some additional resources that are available in ICARE. We have the VFC Inventory Analysis Helper Report. This is a helpful tool for those that are using an EMR. It'll show any patient where there is a mismatch of data. And then there's also a detailed video with script under the ICARE training videos. The user manual is also a really helpful tool in ICARE, as well as the training videos that always has new videos that are being added. This is a screenshot of how to find the videos within ICARE. You can see that we've highlighted the user manuals that you can find right here on the left side of your screen, and then there are also the training videos that are highlighted here. And then under the ICARE tab in How To, that's also where you'll find a list of the training videos. And then the ones with flags are just what ICARE designates as some more helpful or useful videos that they highly recommend that people watch. And then all of the newer videos recorded are also available with a closed captioning in order to be ADA compliant. Patient list refresh. This is something that ICARE highly recommends, refreshing the patient list before you use your reminder recall function. It's also something that's only available under the Patients tab, which only the Keymaster can see. So this is a refresh list that the Keymaster will have to run, and not just everyone in the clinic. And then also, patients who do not match the selection criteria will become inactive in your clinic, and then you can run this report as many times as you want throughout the day, every morning, weekly, basically, whatever you feel like. Here's a screenshot of how the refresh list looks when you're trying to find it. And then before you apply the changes, you can review them. And then if you decide that the results aren't exactly what you were looking for, you can change the criteria and rerun the report. There's a refresh patient list video that you can watch under the training videos, and there's also a user manual that has more detailed instructions on how to do the patient list refresh. Customizing letters. This is something that's helpful and useful for when you're sending out reminder recalls for patients. Here's a quick screenshot of how you can add the new letter, and then another screenshot of a generated letter. This one was for flu. And then how to run the patient reminder recall report. This is a report that generates a list of patients that are being forecasted within ICARE for an immunization. You can specify it by 3 things: the birth range, immunization due date, or shot groups. You can also filter by either one of these or multiple. Here's a screenshot of how the patient reminder recall looks when you're trying to do it. And then next, this is just showing you that once you have a list of patients, the following things that you can do with that is you can create address labels for it. You can generate a patient list export, a Excel file, or you can generate letters or postcards. And then you have to customize the letters or postcards on the reports page, and we showed you how to do that earlier on in the webinar. Here's an example of what it looks like when you have generated the report. And then notice that in this example, we selected the option for letters and that we want to print the flu letter that we've created. For further and more detailed instructions on reminder recall, you can go ahead and view the reminder recall video and then also read the user manual. ICARE also offers a variety of coverage level reports, and we know that many practices have been implementing quality improvement initiatives, but they might not be aware that these reports are available within ICARE. You can easily use these reports in order to monitor coverage levels for quality improvement. These reports are accessible under the Reports tab on the clinic page, and it's quick and easily accessible, and it mirrors the National Immunization Survey collection methodologies. You can have both pediatric and adolescent coverage levels. In order to run this report, this one specifically is the adolescent coverage level report, and it's used to determine the adolescent coverage levels. You would go to Reports, choose Adolescent Coverage Level, choose Report Options, and click Print this window. The report pops up in a new window, and then it will show all the vaccine-specific coverage level by the 18th birthday of the patient. This is a screenshot of when you first get there. You would click on Print this report, and then here is an example of what a generated adolescent coverage level report looks like. This data was generated from the test environment, so no need to worry about any HIPAA violations. Next, we're going to review the childhood coverage level report. And I just want to remind everyone to please refresh their levels before running the report, and that ICARE has also been programmed recently to recognize the 2-dose HPV schedule. So to run this report, you go to Reports, you choose Childhood Coverage Level Report, choose Report Options, and click Print this report. The report opens up in a new window, and it shows the vaccine-specific coverage level based on the criteria that you entered. Here's a screenshot of what it looks like when you're trying to get to it. And then this is a screenshot, once again, generated from our test environment of what the report looks like. And here I just want to remind everyone that it's really helpful to add in your own private immunization shot records, because then this way when you generate your report, you'll get something that represents your clinic completely and not just something that represents your VFC patients. Like, as you can tell, I think in this example, we were only entering in our VFC patients, and so it shows a pretty low percentage level, like 3.8, and that we only vaccinated 8 people for DTaP. But if you include your private immunization data, then obviously it'll be a number that's more representative of your clinic, and it won't be as low since it's not just showing like a smaller percentage of every patient that you see. And then next we're going to go over vaccine information statements and how to run a VIS report. The VIS report shows a list of all the VIS status dates. It shows the vaccine name, the CDC VIS date, the local VIS date, and the data implemented. It visually shows a green check or red X to indicate whether the CDC VIS date is the same as the local VIS date. So to run this report, it's basically the same as running the other adolescent coverage level reports. You go to reports, you find the vaccine management section, and then you click on the vaccine information statement in order to launch the VIS report pop-up. You choose the report options and click print this report, and then it'll open up in a new browser. In order to access the VIS statements report tab, you go to the vaccines module and then you click on the VIS dates tab. So this tab is something that's really helpful for everyone because it's required by federal law that all providers have to provide the most relevant and current VIS statement to either the patient, parent, or legal guardian prior to each dose of the vaccine being administered. So in order to make sure that you're actually passing out the most recent and up-to-date VIS, this screen keeps track of what VIS statements the clinic is currently using and when the clinic began using it. And then if the CDC VIS date matches the local VIS date, then it'll be displayed with the green check mark. And then if it is not correct, then either CDC has updated their VIS date or your clinic is currently using an older version, and then it will have a red X. If you see the red X, then you should definitely go ahead and change the VIS that you are currently using at your clinic. And if you have any more questions about VIS statements, you can see the user manual and or training video. So the VAERS vaccine adverse reporting system, all healthcare professionals are required to report certain adverse events, and vaccine manufacturers are required to report all adverse events that come to their attention. The reporting of vaccine adverse events is done through the Vaccine Adverse Events Reporting System, or commonly known as VAERS. You can find a link to VAERS through one of the ICARE homepages, and it will be under the Immunization Links tab. VAERS accepts and analyzes reports of adverse events, any possible side effects after a person has received a vaccination. Anyone at the clinic can report an adverse event or even any administration errors to VAERS. So by administration errors, if like you entered in like the wrong date or the wrong shot, then you can also report that to VAERS in the system. To quickly summarize that, you can access VAERS quickly either through the direct site or accessing it through ICARE's system. Now we're going to go over some commonly asked questions and answers. So, does ICARE calculate immunization due dates for patients? The answer for that is yes. ICARE uses the ACIP minimum recommended schedule. Question: why am I always having to change my password? Answer: all ICARE passwords expire every 89 days. You can either call 217-534-3648, or you can change your password online prior to being notified on the 90th day. Please be sure to change your password before it expires. And the reason for why you're always having to change your password is because ICARE obviously has very user-sensitive information, and in order to prevent anybody from who shouldn't be having access to ICARE to gain access to ICARE, we just ask for more security reasons that your password be updated every 90 days. Question: why should I use ICARE when I'm already using an EMR? Answer: if you are a VFC provider, you are required to use ICARE, largely because you have to order your vaccines through ICARE and also enter in the patient-level immunization data. It's also important to check ICARE and run the coverage level reports regularly so that you can ensure that your EMR is transferring data correctly. Another reason why it's important or good to use ICARE is it's really easy, as we showed you earlier, to generate those reports that you can use for any quality improvement projects. So if you're already commonly entering in all of your immunization data into ICARE, it would be super easy to go ahead and run the report and then print it out for that reason. Question: is ICARE bidirectional? Yes, as we discussed earlier on in the presentation, the HTTPS EMR is bidirectional and it can accept bidirectional data. You'll need to contact ICARE in order to set up the bidirectional data transfer. Question: does ICARE recognize the 4-day grace period? Answer: yes, Illinois does recognize the 4-day grace period. It will be fully implemented in ICARE on November 1st, 2017. Prior to that date, please email dph.icare@illinois.gov to have the immunization overridden to show valid. Hopefully everybody was a little bit excited about that new information. I know that over here at ICAP, it was definitely something that we were really happy to hear. So now we're going to go over password support. If you haven't registered for password resets to be done online yet, go to imreg.illinois.gov. If you've already registered and need to reset your password, you must go to imreset.illinois.gov to reset. If you haven't registered already, and if you forgot your password or your password has expired, call 217-524-3648 and they will help you register and reset your password. Some new password updates: you can no longer call to reset your password unless you haven't registered it yet. So you can only call if you haven't registered. Everybody now must register online at this idphnet.illinois.gov website in order to reset your password. And if you don't know your password at all, you will need to send an email from the email address that's associated with your username to dph.helpdesk@illinois.gov. Also, a really important reminder to everyone is that you cannot have multiple usernames registered under one email address. So each unique username needs its own unique email address. So we've reached the end now, and I'm just going to show everyone the ICARE contact information. That's really helpful. So for all questions regarding ICARE, logging in, new employees, new clinics, you would go to this email address. For any IDPH VFC questions, you would go to the dph.vaccines@illinois.gov. And then if it's a Chicago-related VFC question, it's this email address, at the bottom, the Chicago VFC email address. And then for any questions regarding importing data from EMR to ICARE, you would go to dph.hl7icare@illinois.gov. And then lastly, for any HL7 password support, you would go to dph.helpdesk@illinois.gov. So that about concludes our presentation. And now I'm going to go ahead and take a look to see if we've had any questions.
Let's go back. And I'll jump in. Okay, so as Anne has mentioned, this portion of the webinar is open for a question and answer session. And if you have any questions, please type them into the control panel on the right-hand side of your screen. And we are not receiving any questions at this time.
Oh, I did get a question about the copy of the PowerPoint. So just another quick reminder to everyone that by end of business day, we will be sending out a copy of the PowerPoint to everyone. So everyone will have all of the relevant contact information as well as the links and the screenshots to the information within ICARE.
Okay, and then we are seeing a few questions come in that seem to be a specific question that is related to your provider location. And for those questions, ICAP will reach out to you offline and direct you to the best contact person at IDPH that would be able to support your provider location. So with that, this brings us to a closing for today's webinar. Thank you for joining us on today's webinar. Please join us for our influenza webinar scheduled for Tuesday, November 7th with Jennifer Burns. By the end of business day tomorrow, you will receive an email with a link to the recording of today's webinar, a PDF of the PowerPoint presentation, and a link to your evaluation. After 2 weeks, the evaluation will be closed and you will receive your certificate of attendance and CME credits will be awarded. Once the evaluation is closed after 2 weeks, you will not be allowed to fill out the evaluation and you will not be receiving certificate of attendance for participation. So please make sure to get your evaluations in within the 2-week time period. And once again, I want to thank Anne Wong for her informative ICARE presentation and to everyone for joining us on today's webinar. We look forward to returning in November. Thank you.
Thanks, everyone.